Okay, welcome to the May Health Committee of the Albany County Legislature. What I'd like to do is hold the meeting to order. Before we start, Rebecca, can you read the roll?
Sure, Mr. Chairman. Ray Joyce,
Present.
Reedy,
Here.
Beston,
Here.
Collins,
Here.
McLean Lane, Miller,
Present.
Moriello, Ward,
Present.
and Willingham. 6 present, Mr. Chairman.
Thank you, Rebecca. Under previous business, number 1, approving previous meeting minutes. Can I get a motion?
I'll make the
Motion.
Motion made. Word, second by Mr. Beston, I believe. All in favor?
Aye.
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 Any opposed? Unanimous. Number 2, I believe, is going to be withdrawn. Local law number K for 2021, local law of the County of Albany, New York, to provide for the safe disposal of opioid medications. That is withdrawn, Rebecca. Can you confirm?
Yes, it is, as is item 3.
All right, great. Thank you. So 2 and 3 are withdrawn. And our current business, number 4, authorizing a rate settlement agreement between the Department of Mental Health and Capital District Physicians Health Plan, Inc., and amending the 2022 Department of Mental Health budget. Is Dr. Giordano on?
Yes, sir.
Hey, good afternoon. How are you?
I'm well. Thank you very much. We are requesting to enter into a rate settlement agreement with CDPHP. It's premised on a recent audit that CDPHP went through, in which it was discovered that a rate increase for the Medicaid managed care contracts that they have with providers like ourselves didn't reflect a state rate increase. And they have proposed to pay us in a lump sum of $52,842 to remedy that lack of appropriate payment to us. So we'd like to enter into a rate settlement agreement to enact this.
All right, thank you, Dr. Giordano. Do we have any questions from the committee? Hearing none, can I get a motion to move?
So moved.
Take motion.
Ed, in lane by Mr. Ward, all in favor?
Aye.
Aye.
Any opposed? Unanimous.
Thank you.
Dr. That's
Thank
all
you,
had.
thank you, Mr. Chairman, and good evening to everyone.
Excuse me. Number 5, authorizing an agreement with the New York State Department of Health regarding disease intervention services and amending the 2022 Department of Health budget. I think I saw Dr. Whalen on.
Yes, I'm on. Good evening, everyone, Mr. Chairman and everyone. So this is renewed funding that we are accepting from the state DOH. It's a 5-year grant from January of this year to December of 2026 with $250,000 each year. It is part of our STD services designed to decrease the burden of STDs, increase the links to care, and decrease transmission by partner notification.
Thank you, Dr. Whalen. Do we have any questions from the committee? Approve.
I'll make a motion.
Motion by Mr. Miller. Do we have a second?
Second.
Second by Ms. McLean Lane. All in favor?
Aye.
Aye.
Any unanimous. Number 6, authorizing an agreement with the New York State Department of Health regarding the Perinatal and Infant Community Health Collaboratives Program and amending the 2022 Department of Health budget.
Wonderful. So this is something that we came to you to apply for. It is funding from state DOH to increase well-being of individuals in prenatal, postpartum, and interconception period. And it's a goal of $440,000 for 5 years. So the total grant value is $2.2 million. This is taking the place of our maternal child health funding that we previously had, and involves community programming and home visits to moms and babies and a lot of educational initiatives as well.
Thank you, Dr. Whalen. Do we have any questions from the committee? Hearing none, can we get a approved?
I'll make the motion.
Second.
Motion made by Mr. Ward. I think the second was by Mr. Miller. All in favor?
Aye.
Aye.
Any opposed? Thank you. Number 7, authorizing an agreement with the New York State Department of Health, Health Research Incorporated regarding the Public Health Emergency Preparedness Program.
This is another longstanding program, and it's contracting with New York State Department of Health and HRI for the amount of $327,000 for the period of July 2022 to June 23. And the funding is used for a lot of our public health preparedness staffing, improving Albany County's capacity for public health emergency response, and training and drilling our MRC. Medical Reserve Corps.
I'm sorry, what was that?
I said MRC and then realized I shouldn't have used an acronym, so I said Medical Reserve Corps, just in case.
Well, past 2 years. Any questions from the committee?
Could I ask one question, Mr.
Go
Chair?
ahead.
Doctor, in the past, we had trained for several years on local pods,
Yep.
which I know were a part of this grant. Is that something, is that going by the wayside? Is the state going a different route, or are we still looking to do that in the case of smaller emergencies? Or I'm just kind of curious.
Yeah, there's multiple different trainings that we do, whether it's medical countermeasures or for vaccine clinics like the ones we have run. And yes, those are all part of training. I don't think the state has decided to go any a different route. I mean, with COVID, obviously, we are becoming more dependent and more, I think the county residents are happy to have greater availability of places to get vaccination in their primary care offices and pharmacies, et cetera. But for large scale emergencies, we would be able to deploy a large amount of vaccines in a small amount of time.
Okay. I guess the question is, are they still looking, will you be training municipal staffs as part of this grant, or is that going?
So I'm not sure if there are specific trainings that we do for municipal staff. That's something we can always do if there is a request for it.
We did it for several years before COVID and anticipated during COVID. And believe me, I'm glad that, the state and the county took over in the regional sites as opposed to trying to do it locally. But there are, as you know, smaller scale operations that would be best served in neighborhoods.
Yes.
And that's where, for years, the local municipalities trained for that. And, I just didn't know if that was past practice or if we're going on to newer ways of doing it.
No, it certainly isn't. Most of the drills that we normally conduct outside of, the response for COVID do include municipalities and include our first responding community and
Right.
a lot of the local emergency preparedness workers.
Okay. All right. Thank you.
Thank you, Sean. Any other questions from the committee?
No, Chairman, just make a statement if I could real quick on that.
Go ahead, Mr. Miller.
Yep, just as somebody who's been in the MRC and been a volunteer, and as somebody who is a lifelong educator and has benefited from this and represents a lot of those people, I want to thank the Department of Health. We wouldn't be able to have gotten through this very difficult time without that support and without a great effect on the educational part of it. I think people miss that. The Department of Health picking up this whole side of things, we didn't have to use those very limited resources we have that would go to education, which is very important. So thank you very much for that. And with that, I'd like to make a motion to move that, please.
I'll second it.
Okay, thank you, Mr. Miller. And we have
I
a motion.
second your comments too, Mr. Miller.
Thank you, sir.
Well, if I could just say thank you to Mr. Miller as well for coming to our pods and participating, it was greatly appreciated.
A motion and a second by Mr. Ward. All in favor?
Aye.
Opposed? Unanimous. Number 8, amending the resolution number 251 for 2021 regarding the COVID-19 grant funding.
So this is grant funding that has come to us for the schools to support safe in-person instruction in the K through 12 population. And the funding has been, there's a no-cost extension. The end date is now 7/31/2023.
This is to supply schools with PCR test kits. It looks like masks, gloves, cleaning
Yep.
supplies, air purifiers.
Yes.
Any questions from the committee?
I don't have any questions, but this is the one I was actually working on, Dr. Whalen. I was ahead of myself on my Granicus here. So this is the one I was making.
Okay.
This is the one I meant to comment on. So thank you. But I'll make a motion to move it though, Ray.
Mr. Chair,
Um,
I was a beneficiary this past week from the school providing me some tests. So,
okay, so before we have a motion, Miller, was there any other questions? So we have a motion by Mr. Miller, and I think Ali would like to make the second.
I'd love to make the second. Thank you very much.
All right. For the motion, we have a second. All in favor?
Aye.
Aye.
Any opposed? Unanimous. Number 9, authorizing an agreement with Boston Air for the purchase of 5,000 air purifiers for K-12 schools and amending the 2022 Department of Health budget.
So this is from the funding that we were just discussing, and we asked the schools what they wanted to use. The air purifiers are evidence-based and proven strategies, not only to control COVID, but general viral diseases, which, as we know, usually run rife at this time of the year in the school community. This is a request to purchase 5,000 air purifiers.
Dr. Whalen, do we have any questions from the committee?
Mr. Chair, I have a question.
Go ahead, Sean.
For the doctor. Doctor, I was looking through the backup and I noticed these seem like room air purifiers. They're portable. So 5,000 seems like a drop in the bucket as far as all the schools in our county. How much of an impact will these have in each school?
Right. So, obviously there's not enough to put one in every single classroom. And we did survey the schools to ask, if it would be amenable to them. Some of their classrooms may have higher proportion of students or be more difficult to control. So we really did leave that to them so that we could utilize all the resources that we have in the best possible way.
Mm-hmm. So I would assume, I don't know how many schools we have in the county.
Ms. Witherspoon, I know you did the survey for that. Would you have some more information on a granular level?
So we did send out a survey to all the schools, and this is the independent schools, public schools, parochial schools, and asked them the square footage of their classrooms, one, if they were interested in receiving these portable air purifiers, and then their student population, because that's how we are distributing them.
Okay, so it's fair to say it sounds like everybody's going to get one or two of them, or a few of them anyway, based on population. So
yes, there are some schools. Yeah, there are some schools that's going to get a couple hundred based on, who responded and their school population.
Yeah, I think it's a great idea. I was just kind of curious how they were distributed. That's all. Thank you.
You're welcome.
Sean, Dr. Whalen, Ms. Witherspoon, any other questions from the committee?
Yes, I believe my question has been answered, but I'm just going to. So this wouldn't just be the public school districts. This would include the independent schools, the parochial schools, et cetera. It sounds like it does. I'm just,
Yes.
I guess, reiterating just in case.
Yes.
Yes.
Wonderful. I appreciate that. Thank you.
And Dr. Whalen, just a quick question, only because we supply these air purifiers in our control rooms for National Grid, and the one thing we didn't have that became difficult for us to find were the actual filters. Do you know if this company supplying additional filters, or is that something the schools will have to follow up on individually?
So I'll just comment on that. The filter that it comes with is guaranteed up to 5 years for one. So I think they're pretty set for now. And when the time comes to supply them with more, we'll see what funding we have. But they're good for 5 years.
Well, that's great. Ours were 6 months, so thank you for that. Good. It's sounds like something we should be looking into. And maybe we'll be in the endemic in 5 years. Who knows? We're thinking. Can we get a motion to approve?
Mr. Chairman?
I'll make the motion.
I'm sorry, you have a question, Mark?
Yeah, if I could. Yeah, given the concern over indoor air, this is really a positive step, and the state's going to reimburse us for 100%, I believe.
Yes.
And I was concerned about where these were going. In fact, the staff provided me with a list of everyone, and what I like, it's private Catholic schools, Hebrew, charter schools, public schools. Everyone's going to get these based on population.
That's right.
But I'm a little unclear. Some they'll get X amount of purifiers, and they decide what rooms to put them in. So wouldn't the air be better in some rooms than others? Is it fair to the classes in the other rooms, I guess?
So, again, what we're trying to do is work with the schools to determine where these can be best placed. I wish that we could say we could put one in every room, but that's we don't have funding to support that. So hopefully they'll be able to choose where they would be best used.
So they'll use their own discretion to make the most of what they have then, basically.
I'm not sure whether the company that we're contracting with would be able to provide any assistance on that. Perhaps they would, but I don't know that.
Do you have experience with these purifiers, and how effective are they, Dr. Whalen? Do you know?
So I don't have experience with them. We did do research to, determine the companies that we would contract with. We did, of course, make sure that these were evidence-based, that they were viewed by, federal health authorities as a good control mechanism. So evidence-based. So I can say that they are evidence-based products, and that we do feel like they will be effective in reducing the transmission of disease.
Okay, great. Thanks. Thanks, Chairman Joyce.
Thank you, Mr. Grimm. Any other questions from the committee?
I did, Ray. Just to follow up on that.
Sure.
A lot of the schools use their COVID money some of the COVID money we've had to buy these kind of air filters as well. So they have their own already, but also we did not have nearly enough money in schools to outfit every classroom. Usually went to those teachers or classrooms that had teachers or students with pre-existing conditions or other ADA kind of issues. So I think this would be great to sort of fill in the gap. I think most schools will use this to maybe not be in every single classroom again, but fill in those gaps where people wanted it and couldn't get them.
Thank you, Miller. Any other questions from the committee? Hearing none, can I get a motion to approve?
I'll make
Motion.
A motion by the board, second by, I think, Ms. McLean Lane. All in favor?
Aye.
Any opposed? Unanimous. Excuse me. Number 10, authorizing the submission of a grant application to the Governor's Traffic Safety Committee regarding the 2023 General Highway Safety Grant. Dr. Brown, this one's yours too, I believe.
It is. I'm sorry. I didn't realize I was muted. Excuse me. So this is a grant that we had been awarded in 2019, 2020, and 2021. We are working with municipalities and others to provide pedestrian safety, looking at high-risk intersections, and providing safety education in schools and conducting community outreach regarding pedestrian safety.
Thank you, Doctor. This is 100% state funded. Any questions from the committee? Hearing no questions, can we get a motion to approve?
Make a
I'll
motion.
make the motion.
Motion made by Mr. Miller. Do we have a second?
Second.
Second by Mr. Ward. All in favor?
Aye.
Opposed? That's unanimous. And that looks like the last item on our agenda tonight. So thank you, Dr. Rowland and Ms. Witherspoon. Thank you to the committee. Can I get a
Second.
unanimous? Have a good week. Memorial Day weekend.